Ischemic heart disease impacts millions worldwide. What pharmacological treatments are effective in managing this condition? This tutorial will delve into key medications for IHD management. Our objective is to equip you with essential insights. Let's first focus on enhancing blood circulation. Glyceryl Trinitrate effectively promotes coronary blood flow through vasodilation. It's indicated for treating acute angina and chronic prevention. Next, we aim at decreasing oxygen demand. V blockers and ACE inhibitors lower heart rate and contractility significantly. These medications effectively lessen the workload on the heart. Now, let's address atherosclerosis management. Lipid-lowering agents, particularly statins, play a crucial role. They assist in slowing the progression of atherosclerosis. Moving forward, we'll discuss organic nitrates. These release nitric oxide, facilitating vasodilation. Be mindful of hypotension and tolerance-related issues. Next, let's consider V blockers. These work by blocking V1 adrenergic receptors, leading to a decreased heart rate. They are useful for treating tachyarrhythmias and managing angina. Note: patients with respiratory conditions may experience risks. Now, let's examine calcium channel blockers. These medications block calcium influx, helping to lower heart rate. They are beneficial for supraventricular tachycardias and angina. Avoid using them in combination with V blockers due to bradycardia concerns. Next, we will discuss potassium channel activators, such as Nicorandil. These enhance vasodilation through their unique mechanisms. However, you must monitor for potential headaches and ulcer formation. In cases of acute myocardial infarction, immediate action is crucial. Administer aspirin for its antiplatelet properties. Provide oxygen therapy to improve tissue oxygenation. Organize the administration of nitrates and anticoagulants to avert complications. Incorporate V blockers and ACE inhibitors for effective long-term management. Here's a summary of the management algorithm. Initiate treatment with antiplatelet agents and anticoagulants. Proceed with nitrates and V blockers as required. Pharmacotherapy in IHD encompasses various agents. Comprehend their roles in enhancing blood flow and mitigating risks. Awareness of mechanisms and side effects is crucial. Now, integrate your newfound knowledge into clinical practice. Consult local guidelines prior to treatment for optimal patient care. Thank you for participating in this IHD management tutorial.